Okay, welcome, guys. Today we'll be discussing another very important topic. Of course, something you are very familiar with, hepatitis. But we'll be narrowing it down to the viral hepatitis. Okay, we have many things that can cause hepatitis. So, but we'll be discussing on the viral hepatitis infection. So, of course, whenever you hear anything hepatitis, it means inflammation of the liver. Inflammation, I mean, is like is like when you hit maybe something hit you on a hand like this, and you see the person in the place swollen, reddish, and painful. So that is the picture I want you to use and imagine how the inflammation looks like. Okay, so but the one happening in the liver in the cause of hepatitis is much more severe and deteriorating. So and there are 5 species of virus that causes hepatitis. One is hepatitis A, hepatitis B, hepatitis C, hepatitis D, and hepatitis E. So hepatitis D and E is rare, especially in this part of Africa. It's not very common. Okay, so then the 3 major ones are hepatitis A, hepatitis B, and hepatitis C. Now, in the course of hepatitis A, talking about hepatitis A is not much a problem. It's not much of a problem. The reason being that our immune system usually handle it, especially in adults. Okay, that's why you don't see it much in adults, though it affects children. But even at that, it can still be, managed and clear. All right. So, but the major ones, the commonest ones, are hepatitis B and C, especially hepatitis B. Now, give me your ear. Hepatitis B is dangerous. It's a killer disease. Some people call it the silent killer. It's silent killer. So, I will be discussing more on this hepatitis B. Yes. So, hepatitis B, is the infection is of 2 types: acute and the chronic hepatitis B viral infection. So, the acute, I mean, is that if you contract the virus, immediately the target is the liver. It begins to attack the liver. The person will fall sick, and if rushed to the hospital, and the hospital happen to discover that it is hepatitis B, the acute, so they can actually work on it, boost the immune system, and they can even clear if the hospital knows how to manage it well. So the acute is even easier to manage. But the most dangerous is chronic. Chronic hepatitis B. That chronic means that the virus will be eating up the person's liver gradually. You'll be alive, but you are dying. So the next thing is that the person's, is sick today, within a few days, the person is gone. Because once the liver is damaged, unless liver transplant, of course, if you can afford it. So, but chronic hepatitis B is more deadly than other types. So, but then that chronic also has, it can also be divided into 2 anyway. So we have the latent, what I call the latent chronic hepatitis B. So latent, I mean, is that some people call it the carriers. So the person is carrying it and is not disturbing the person. So the latent, I mean, is that the virus can be there, but it's not disturbing the person. Of course, I have seen many cases like this. So the person's immune system can actually suppress it, and the virus will not really affect the person, or probably the viral load is very minimal. It hasn't gotten to the liver yet, because once the virus have not started to attack your liver, you are good to go. So these kind of people can live for years, provided their immune system is holding up the virus. Yes, I know someone that has stayed with it for 60 years and she's still alive. So, and she's not taking drugs for once. She's just fine. But she will run test and it's positive. The viral load is minimal. So there are cases like that. So, but the one that is a problem is the active chronic hepatitis. Active. So remember, we have the latent and the active. So that active chronic will just be gradually eating up the liver. You will not know. You will not know. And that one is what I usually lead to cancer of the liver. Cancer of the liver. So hepatitis B contributes to the highest rate of liver cancer worldwide. Liver cirrhosis. So it's deadly. So it is important that you that are watching this video, after this video, please share this video. Anyone that watches this video should try as much as possible, go and check yourself, because you can have it and not know. Most of the diagnoses are usually accidental. Maybe the person comes to clinic and want to do premarital test, and eventually will now discover. And the same way, many has died unknowingly that is hepatitis B. So after watching this video, make sure you go and check yourself. Run hepatitis B, know your status. Of course, if you are positive, I would say it's a good news. In the sense that at least you will know that you are positive, and you can now follow it up and handle it properly. If you are negative, it's still a good news. So you can take just rush to the nearest health center or clinic and take the vaccine. There is a vaccine for hepatitis B. The vaccine will protect you from contracting the virus from the person, from anybody carrying it. Okay, so if you do the test and you test negative, rush and take the vaccine. Don't sit back before it becomes too late. It is spreading like wildfire. Of course, we all know much about HIV, but hepatitis is a brother to HIV. It doesn't have cure. Some people say it is worse than HIV. Anyway, I don't really concur to that. I don't really believe it is worse than HIV. My reasons being that, one, if it's acute, it can be well managed and taken care of if discovered on time. If it's some people still are carriers, they're carrying it and it's not killing them, and there is also vaccine for it, so you can take it. You can take the vaccine and it will protect you from contracting. But HIV has no vaccine. So me, I still see HIV as the chairman of all these viral infections, of course. So I don't like comparing hepatitis B to HIV, not at all. Though hepatitis B is dangerous in its own way, in the sense that you can have it and you may not know. But HIV, once you contract it, after some time, it gives you signal, you know. Sorry, I had to clean up sweats. But we're in Africa, it is too much. So then another area where I consider it dangerous is in the sense of the fact that it can cause liver cancer. So liver cancer is something you wouldn't want to experience. So hepatitis B is bad. It's bad, but I don't believe it was than HIV. But nevertheless, it's as bad as HIV. So now the question is, how can someone contract this thing? Someone can contract it. It's mostly through blood-to-blood contact. Yes, although some people say if somebody that has it, if the person sweat touches you, you contract it. Actually, there are no research to prove that yet, unless the person that's carrying it has a wound, and you too that is touching the person has a wound. Through that blood-to-blood contact, you can contract it. But then usually it's through blood-to-blood contact, maybe sharing sharp objects, through sexual intercourse, kissing. No research has proved so far that it can be gotten through kissing, or unless you have wound in your mouth. Okay, so but nevertheless, the virus is spreading because you will not know who is carrying it, especially when it's chronic. So go and check yourself. If you're negative, like I said, take the vaccine and protect yourself. All right, so please, if you like this video, if you watch this video and there is, there are some valuable information you got from this, don't forget to like, share and subscribe to our channel for more videos. Thank you very much. See you on our next video. My name is Harrison. I'm here to always bring to you some vital health information that will help you. Take care.